Afternoon, each and everyone. Last time we spoke about thiazide diuretics, and today we're talking about loop diuretics. So, can anyone just tell me what are the drugs which act as a loop diuretics and where it acts? Furosemide, uh huh, torosomide again, and acetate carbonic anhydrase, and butanide and ethylacrenic acid. Okay, so actually, loop diuretics considered to be the most effective and strong diuretics, which are used in the like many of the therapeutic use, like hypertension, edema, and so on. Okay, so coming to the pharmacokinetics of furosemide, the most loop diuretics which are used are two, furosemide and torsemide. So there are slight difference between these two medications. Torsemide actually has a rapid action compared to furosemide. The half life of it is just 1 hour, onset of action after 1 hour, compared to furosemide, which take 1 to 3 hours to show the actions. Okay, and then duration of action, furosemide take only 2 to 3 hours, like the duration of action, but compared to furosemide, it takes only 4 to 6 hours. Okay, so coming to the relative potency, furosemide have one relative potency. So the more we increasing the relative potency, the less dose we are giving. Okay, so for furosemide, it has one, like the relative potency of furosemide is one. So the dose is considered to be from 20 to 80, range from 20 to 80, depending on the like indications, how much doctor will give. Furosemide, the relative potency is 3. So the dose will be from 5 to 20. So furosemide is from 20 to 80. Furosemide is from 5 to 20. Butamide, the dose is 0.5 to 2 mg. And the last one is ethylacrenic acid is from 50 to 20 mg because it has less relative potency. Relative potency is the potency of the drug, the action of the drug. Coming to the mechanism of action, can anyone tell how it acts? Furosemide, torsemide, loop diuretics in general. It's actually diuretics, right? So it will excrete what? Water, right? So everybody, huh? Yeah, reduce the absorption of sodium, potassium, and chloride. That is one mechanism. So if there is excretion of the water, what will happen? The blood volume will be reduced, right? So if the blood volume will be reduced, what will happen? There will be drop in the blood pressure. That is one thing. Second thing, decrease the renal vascular resistance. The blood pressure is nothing but the cardiac output and the peripheral vascular resistance, right? The narrowing of the blood vessels. So furosemide has different mechanisms or another mechanisms which decrease the renal vascular resistance and increase renal blood flow through what? Through polypeptide called as prostaglandins. The prostaglandins act as a vasodilators, right? So the furosemide increase the level of prostaglandins at the renal size, which cause renal vascular dilatations. And this is the second mechanism which reduce the blood pressure. Okay, so which medications we know to, you know, block or reduce the prostaglandins? Folks, yeah, in general, NSAIDs. So NSAIDs contraindicate or have interaction with the loop diuretics. Okay, coming to therapeutic use, we have first edema, any kind of edema which goes by either by congestive heart failure, renal problems, or also like liver problems. Any type of edema, furosemide, or loop diuretics is the first choice for the reduction of accumulation fluids. Second, hypertensions. It's either used alone or along with the other antihypertensive medications. Third thing, oliguria. What is oliguria? You think? Decrease. So if the output of the patient is less than 40 ml, okay, 40 ml per day, we'll give furosemide, but the dose is different. Usually we give 20 to 80, you said, like furosemide, right? But in case of oliguria, we'll give 500 mg if it is tablets. Otherwise, 250 mg if it is IV. to it just to like stimulate the kidney to excrete water. There's only those indication, like only like those 500 mg in case of oliguria. Other as like non-specific use could be used in the hypokalemia to increase the because it's accumulate the potassium. In case of hypokalemia, we can use hyperkalemia. I mean, we can use loop diuretics. Coming to the side effects, anyone knows in like side effect? Hyponatremia, hypokalemia, hypotension, exactly. So we'll just sort them one by one with the cause, like with the like explanation about it. Hypokalemia and metabolic alkalosis, that is due to increase in the secretion of the potassium and hydrogen. So that's why it will cause hypokalemia and metabolic alkalosis, because much hydrogen will go out. There'll be increase in the bicarbonate, and the also potassium will go out also, which cause hypokalemia. That is one thing. Autotoxicity, but it is a dose dependence. As much as we increasing the dose of the furosemide, there is a chance of autotoxicity. Or if the furosemide is given along with the any autotoxic, like medication styles, aminoglycosides, exactly. And then again, hyperuricemia. Hyperuricemia, that is due to the increase in the reabsorption of uric acid. So patient who will be having gout, drug is contraindicated, or at least has to be monitored because it will increase the reabsorption of uric acid. Again, hypomagnesemia, but it is in the chronic use of the diuretics. It might cause hypermagnesemia. Again, hyponatremia because due to the increase in the secretion of sodium. Okay. Then hyperglycemia, it is there, but it is more common in thiazide diuretics. Okay. And then hypersensitivity due to what? Why people like might develop some hypersensitivity. I have explained in the thiazide diuretics, so people who attend might know. Hypersensitivity, anyone? Okay, so if you came to the structure of like loop diuretics, like furosemide, it has sulfur groups. Most of the people have the like allergies to the sulfur. So yeah, most of the patient, anyone who is allergic to sulfur groups will have hypersensitivity to the loop diuretics. And calcium balance remain neutral. Why? Actually, it will excrete the calcium. But in case of furosemide, people will not have any hypocalcemia due to the because it will get regulated by parathyroid hormone, which stimulate the vitamin increase in the vitamin in the intestinal, which compensate for the loss of the calcium. So there is no hypocalcemia. Okay. From the all these side effects, we'll just find out what is the contraindication. So people who like contraindicated in case of digitalis toxicity could cause hypokalemia, right? So hypokalemia increase the toxicity of digitalis, hepatic cirrhosis. Okay, also it's contraindicated. Patient with a history of sulfonamide allergies because of the sulfur groups. Okay, and then patient with the gout. Usually, goat people have high uric acid, right? And furosemide will increase the reabsorption of the uric acid. There's one. And pregnancy. Actually, all the drugs is contraindicated. All the diuretics drugs are contraindicated in the pregnancy, okay, because it causes something called fetotoxic. Okay, but if we are going to use, we need to use any diuretics. We'll go with the potassium sparing, class C. Okay, then coming to the drug interactions, we know like all drug interactions such as aminoglycosides because of the autotoxicity. Again, lithium will decrease the renal lithium. Loop diuretics will decrease the lithium excretion. Again, digitalis due to increase in the digitalis toxicity because furosemide or tiosemide will cause hypokalemia, and this will cause increase in toxicity of the digitalis. NSAIDs because prostaglandins. Again, warfarin. Actually, if you're on loop diuretics, warfarin have a strong called this one plasma protein binding, but furosemide will displace warfarin from blood. If so happen, there will be increase in the level of warfarin, which lead to bleeding. Yeah, exactly. and then propanacid due to decrease in renal tubular excretion of furosemide. That's it. Thank you.